talk to you about things to think about if you're considering going to Mexico or another country to have bariatric surgery. I constantly have patients ask me about that and viewers. So it was requested that I talk a little bit more about the pluses and the possible minuses of doing that. So let's talk about it. Number one, when you go to another country to have bariatric surgery, most people are driven to do that by a few different things. Number one, lower cost. If you're paying out of pocket for a bariatric surgery, chances are it's probably going to be less expensive in another country, at least the upfront cost. Another thing that drives people sometimes is difficulty and the process of getting your surgery approved through your insurance. For example, most insurances that I deal with, it takes about 6 months to get the insurance approved. A lot of insurances, you have to go to your PCP once a month to get a visit documented that you discussed it, to get weighed in. You've got to see a dietitian, you've got to see a mental health professional, you've got to see the surgeon, you've got to do some support groups. Sometimes people don't want to jump through those hoops, and so they consider going out of the country. So, here are some things, with all that being said, to really think about if that's something you're considering and questions to ask. Number one, you need to find out if you consider this and you find, I'm sorry, my nose is itching, and if you find a surgery center out of the country that you are interested in, ask, who is my surgeon going to be? Sometimes these centers will have several different surgeons, and it's a little hard to figure out who exactly is going to be doing your surgery. So you need to get a good solid answer on this, and then do your research. Is this person certified in this type of surgery? What are their credentials? What was their education? Find out these things just like you would any surgeon in the United States. Sometimes it's a little bit harder to come by this information, so be diligent and find out that info before you agree, before you really start that process. Number two, ask them when you do a pre op visit or a pre op telehealth visit, are you suggesting a surgery for me that is a good fit? Or is this the only surgery that you do? I have had many patients tell me about going to a surgery center in Mexico that all they did was the gastric sleeve. The gastric sleeve is a great surgery, but it may not be the right surgery for you. It's a quicker, easier surgery. Sometimes people are pushed towards that because of it. So you need to find out, why is this the surgery you want to do for me? And is it because this is the only surgery that you do? Number three, and this is a big one, what happens if you have a complication? It happens, guys. They're usually not serious, but sometimes they are. Where are you going to go? What are you going to do? If you have those problems, what is the follow up plan? Especially in a surgery center that is outside of the U.S., they need to have a solid plan of how they handle complications. Ask them that. Don't let that get brushed off. Number four, who do I follow up with after surgery? Am I expected just to go back to my PCP for everything? Who am I going to follow up with for nutrition? Who am I going to follow up with for weigh-ins, for lab work? Ask. If I get my surgery here, this is a lifetime commitment. Who is going to be there for you for that lifetime? That's a good question. The other thing, or the next thing that you really need to think about, and this is, I know I say this is a big thing, but it really is. Me as a primary care provider, I see this a lot. Will my home doctor get my records? I have one time gotten a patient's records from a clinic in Mexico. And when I do get them, they're usually in Spanish. Thankfully, that's not an issue in my office, but we need to find out what was done to you. What were your complications? How did that surgery go? This is part of your medical record and will affect your care for the rest of your life. So find out, can my home doctor get my records, and what is the process for that? Another thing, how soon am I going home after surgery? Most likely you're going to be flying home. So you need to find out, how soon am I getting on a plane? Are there any precautions that I need to know before I do that? Am I going to be able to arrange to get, for example, a wheelchair at the airport? How am I going to handle having luggage? Because sometimes you are going to have to be lifting a carry on. If you have lift restrictions and you're traveling by yourself, especially, you need to find out, how long am I expected to stay after surgery, and how long am I going to be able to go home? And then you also need to find out what's that care going to be like after surgery. If you stay, for example, in a recovery house, is that cost included? What kind of care is available there? That goes into my next question. What is included? A lot of times you will go to a website and it will say gastric sleeve, $5,000 in Mexico. Then when you start delving more into it, it is $5,000 for the surgery. Sometimes that does not include things like your anesthesiologist, your medications, your even hospital stays. So you need to find out what is included. Does this include my pre-op, any type of pre-op things that you have to have done, like labs, any type of pre-op visits that you have to have done with a nutritionist? If they want you to have a follow-up afterwards via Zoom or whatever media, is that included? You need to look at the big picture. The other thing that I want you to think about that I think is a fair question is, if I'm having to fly out of the country and I'm having to stay in a recovery house and I'm bringing somebody with me, chances are, there's that additional cost to that person. You may be taking off work longer. When you factor all those things in, is that still a lot less expensive for you to go out of the country? I want you to ask, what type of standards does the hospital that I'm going to be in follow? Are they up to date on standards as far as hospitals, on sanitation, on licensure? That's a big thing. Find out what the name of the facility that you're going to have your surgery at and do some research on it. Read reviews, read their licensure. You have a right to know all that. It doesn't matter how good a surgeon is. If you have surgery in a hospital that cannot handle an emergency or does not have a good standard of care as far as cleanliness, you're going to be at a very high risk of complications. Another thing, guys, this is really important. If I have a problem, is my insurance going to cover it afterwards? If a year down the road I get an ulcer and they can tie it back to this surgery, is my insurance going to cover it? I can tell you on a personal level, my insurance, if I have a procedure out of the country that is considered elective and I have complications, my insurance declines anything related to that. Now, if I travel out of the country and I have an emergency or an accident and have to have a procedure, that's different. But something planned, it's completely out of the cost of the out of pocket cost. There are a lot of things that after you have bariatric surgery that you might have to have in the future. Lab work. Sometimes that lab work, if you're paying out of pocket, can be hundreds of dollars a year. Medications, you may have to take certain medications for a while. And like I said, God forbid you do have a complication. It can be financially devastating. So find out. Call your insurance company. That's the only way to know. And then have them send that policy to you in writing. via email or snail mail, because you may talk to somebody who truly just gives you an answer to get you off the phone. Have it in writing. That way, if that comes up in the future, you will have that information. Last, am I choosing this facility, this procedure out of the country because it's best for me or because it's cheaper? So I want you to really think of all the things that go into bariatric surgery. I realize that for some people, this is the only option for them. And I have had many patients who have gone to Mexico and have had bariatric surgery and have done great. I have had a couple who did not and who have told me, I wish I had never done this outside of the country, because now we can't get their records to find out exactly what went wrong. We can't get in touch with those doctors, and their insurance doesn't cover those complications. So take all that into consideration. This is a lifelong commitment. You are changing your body permanently. I'm not saying don't do it. I'm saying be aware. Do your homework. If you are thinking about a facility, read reviews online. Read the good, read the bad, read the ugly, read the positive. Take all of that into consideration when you make that decision. Guys, I would love to hear, have you thought of going outside of the country for your bariatrics? Did you? Anybody who did, share their experience. I would love to hear where you're at in the process, and I would love to hear video suggestions. As I said, this is a question I get asked constantly, so that's why I wanted to talk about it today. Guys, I hope you have a great week, and I will see you next Wednesday. Bye.